Welcome to Abolition Radio, the broadcast outreach of Love Never Fails, inviting you to join the fight to end human trafficking.
Oh, give me eyes to see. Oh, give me strength to lead. You give me all I need. So give me courage to believe.
Each week, Abolition Radio sheds light on the darkness of modern slavery, celebrates the work of abolitionists who are fighting for freedom, and equips the church to engage in the work of justice with hope rooted in God's Word. Our goal is to see a radio audience become an army of gospel activists.
You're in the neighborhoods we live in. You're in the ones we're passing by. You're in the ones we call our neighbors. And the ones who still escape our eyes.
Now, here's the host of Abolition Radio, founder and executive director of Love Never Fails, Vanessa Scott.
Thanks, Dave, and welcome to Abolition Radio, the broadcast outreach of Love Never Fails. We're here today, of course, with my lovely partner in justice.
Hello, everybody.
Hopkins. Yes, and of course, we have special guests on the show that we're so excited about. Being on the show, but just in general in our lives. She's just doing so much for us, and that is Dr. Carole Crofts. Welcome.
Welcome. Thank you. Thank you, Carol.
Yeah. So Dr. Crofts is a clinical psychologist with a master's in social work and a doctorate in clinical psychology and a postmaster's in psychopharmacology. You see that?
Yeah, you did well. New word.
New one. Recently retired, right, in August.
Yes.
So I'm so jealous, but but is still working, of course, in a limited capacity with Love Never Fails, specifically in the I Am House. Thank you so much.
Yes.
And so when you hear me out and about talking about how we have cognitive therapy in the home, it's being provided by Dr. Crofts, and we have some new developments. But before we talk about that, I wanted to just hear from you about how you started in this, clinical capacity, and what drew you to it.
Clinical capacity in my own...
In your career.
In my career.
Yeah.
I guess, frankly, always wanted to help people.
Yeah.
And wanted to do it professionally. Mm-hmm. And just kept going to school to learn more and more.
Yeah.
And it was always very satisfying. It was actually hard to retire.
I bet.
But after I retired, I heard about Love Never Fails, and it's just worked out very well.
That's how it happens.
Yeah.
Yep. I don't know how, because after I talked to you, a couple of other people called me. I said, no, I'm already committed.
Oh, see, we were first. Yeah.
God had our best interest at heart.
I'm like so many other people. I thought all of this was in Europe and other countries. And when I heard how much the trafficking was here, I thought, this is where I need to put some focus.
Yeah, yeah. Yeah, so I want to actually drill down on a topic. I definitely want to talk about the I Am House and some of the developments there. Actually, just last week, we opened up our phase 2 of our house.
Yeah.
And we're so excited about that. We are currently housing 2 beautiful thrivers that are going to be re-engaging with the community and picking up jobs and going back to school and really becoming all that they were intended to be. And so we're super excited about that. But, I wanted to talk a little bit about your role and just as in terms of working in the cognitive space with survivors of human trafficking and not specifically about the I Am House, because I know there's some confidentiality things that we want to be careful about, but just in general, with your history, things that you've worked on in the past and now what you are experiencing now and specifically around attachment trauma. So I understand, I was talking with a clinician on Friday and attachment trauma or Stockholm syndrome are not part of the DSM. Is that right?
That's right.
And so where does that fall? And DSM, for those that are listening, so I took a class on, I'm actually interested in becoming a doctor as well one day. I aspire to be Dr. Vanessa Russell.
You will be.
But so I took a couple classes, so that's why I know what the acronym is, but maybe you could explain to those that are listening.
The DSM?
Yeah,
the Diagnostic Manual. It changes every so often, and recently has changed a couple of times to make renewed diagnoses. And it's really important I think it makes a contribution to our understanding of the diagnoses because they keep revising it.
Yeah, it's a good sort of context for us to just have a discussion, right? And a way to teach people, right?
Yes.
I mean, a framework for that.
Yes.
Yeah.
But what you brought up in terms of the history and devastation, I would like to talk about eventually. But one of the things I also want to say is that it is not just cognitive.
Yeah.
It's very much emotional as well.
Oh, yes.
We're very much cognitive really deals with the mind in one way.
Yeah.
We're dealing with the whole soul,
right.
really, with emotions. So to just say cognitive therapy doesn't completely
capture it.
Yeah, that's what I was trying to remember.
Yeah,
That's a good point.
Yeah,
that's a good point.
Yeah, the reason why I've characterized it that way is because I've noticed that there's been sort of this theme about what kind of therapy and clinical care you provide. Mm-hmm. And I've tried to help people understand that we're we're going above and beyond in doing art therapy and doing, dealing with the way the mind thinks and dealing with sort of the more tactile, kinesthetic learning which you can address and the healing that you can address through movement, right? Mm-hmm. The somatic therapy, and then the art therapy is more of the visual. Right. And so we're touching the body in all these different places. But I love what you just said. So I'm going to add that to my cookbook. Emotional therapy, exactly. It's all in there, right?
Exactly. Yeah.
And I think our whole goal is that the woman and the children would be restored to a place of wholeness. Complete wholeness. So tell me about that.
Yeah, I want to talk a little about the history of the women.
Yeah.
So often there's trauma and neglect and abuse.
Oh, yeah.
Mm-hmm.
So they have great difficulty in really ever trusting or trusting immediately. It takes a long time for them to believe they can trust. One of the things that I am so pleased about the staff I've been working with at IM is lots of times our women don't tell the truth. Mm-hmm. And that's because that's how they survived.
Yes.
And there's no judgment on the fact that they don't tell the truth.
Right.
Because, as I said, that's how they survived, was trying to get around not telling the truth and just making life okay for themselves through deprivation. And for emotional maturity, a basic concept is that early attachment and structure from early years. Mm-hmm. Mm-hmm. So that's something I think we have to keep in mind as we're working with them, that deprivation, and that it'll take time to move through. But in so many ways, Love Never Fails is providing a lot of resources for that deprivation, empowerment, awareness of self. Right. With religious love never fails. It's so important in my estimation. That's one of the reasons I was attracted to the program, because the spiritual aspect of it can make such a contribution that is so needed.
Yeah.
You mentioned all of those abuses. That's the reason why our education program in the schools is an abuse prevention.
It's wonderful.
And sex trafficking awareness, because those abuses will lead to trafficking if not, dealt with. Mm-hmm. So we address emotional neglect, physical and sexual abuse in our program.
That is just great. It needs to be done very early. You're right.
Preventative.
Yes.
Before they get to that point.
Oh, and then even preventative. Yes,
right.
Absolutely.
Right.
And so on that point, I found it kind of interesting. I'm actually going to be talking with the foster care system in Alameda County to see if they have a trauma-informed a program for children. And I've been really surprised. I've asked around quite a few folks to see if there was something in the way of when someone has experienced attachment trauma with their parents, with their families of origin, what kind of, programming or curriculum is out there to address that? because I know that many of our program members have experienced that, and their children have also experienced it. And as we're working with the children in the home, we want to be able to impart that. So I think I asked you already if you knew of any. And I don't believe you had anything at the tip of your fingers. I've asked several just very well read and researched doctors, and they too didn't have anything. And so, I wanted to just kind of talk about, where does that fit in the DSM? Maybe when we come back from break, where does that fit into the DSM, this attachment issue? And then how does that manifest in terms of love addictions and other sort of relationship addictions? So we'll come right back in just a moment with another session of Abolition Radio.
We'll be back with more Abolition Radio right after these messages.
Trash bills weighing you down? At Case Industries, we specialize in lowering waste costs and providing trash consolidation and compaction services for multifamily properties, condos, and commercial shopping centers. Let us help you reduce operating expenses and increase property NOI. Case Industries, saving the planet, saving you money. Contact us today for a property trash and recycling assessment online at caseindustries.us or call 510-566-4223. That's caseindustries.us or call 510-566-4223. Case Industries, the property manager's friend.
Hi, I'm Sandra Herrera, CEO of Case Industries. I've found that many employers are looking for ways to help the community but don't know how. I encourage you to consider supporting Abolition Radio as a corporate sponsor. Love Never Fails offers all the resources necessary to help young women and men overcome the trauma of exploitation and abuse. And that's why I'm proud to have Case Industries supporting Abolition Radio.
Welcome back to Abolition Radio, where you are invited to join the fight against human trafficking.
And welcome back to Abolition Radio, the broadcast outreach of Love Never Fails. So we were just talking about the need for trauma-informed programming in the foster care system, that is delivered to foster care parents, for programs such as ours that allow women to come with their children to live. One of the things that troubled me, and so I'll talk on myself, because I'm not above the law here. When we opened our home for women and children, I immediately felt like the children were just there. Yes, they're in a safe home. Yes, they were given food and they were going along with mom to this and that program. But what was specifically designed for them? And it just felt like there was a gap there for me. And I began to ask around what's available that helps the child to heal from the abuses that they've endured. And yes, traditional therapy, I think, has been used as a tool, but I could get creative with it. Art therapy, I'm sure, is a great way to go there. But it just feels like there's this specific thing, and by the way, I'm again, here I go self-diagnosing, but or figuring out how I've come to this place. But I grew up with a lot of attachment trauma personally, and I think about the trust issues that creates, and the ways that I have overcome them is absolutely because of my relationship with God and my prayer life. But it's also been people that He's put in my life that were willing to just stand by my side and not take off. And when I thought that they would, when I thought I was being unlovable or unhelpful or whatever. But what I find is when people have been through a lot of that attachment trauma stuff, they or trauma bonding type of relationship as a child, or abuse as a child, and abandonment is really the word that I was looking for. When they've gone through that, I find that they rotate either from between one or two areas, and I'm not a clinician, so I'm just telling you what I've observed, is they either don't want anything to do with you and they're blocking you out, or they're super codependent and they're going way overboard to try and keep you there. because they know that you're going to leave at any time. So if I will just clean your house and I'll just do anything you say. And I definitely was more on the codependent side coming up. And I've had to move that towards the middle and say, no, it's okay to say no. And if they don't want to be my friend because of it, that's okay. But, where does that fall in the spectrum of sort of psychology and the way that we see these relationships develop, specifically in the human trafficking vein? And is there anything diagnosis-wise that we can refer to that sort of captures what is happening there?
Oh, that's interesting. You're kind of referring to the DSM.
Yeah.
And I don't know as we use that so much for treatment as well as trying to define a diagnosis.
Yeah.
What I'm hearing is how important it is for people to recognize what the loss has been, the reactions you just described of not willing to invest at all or becoming overdependent. And that's the awareness of our staff and our people working with them so they can take the time, develop the activities that develop the trusting relationship. And as you talked about the activities you had in terms of art and dance and all, you had consistent people teaching those.
Right.
And it was developing you, and there were people there. It's a wonderful way of developing that, moving through that trauma life, abandonment. But what we all have to realize, it takes time.
It takes time. It's not the easy, quick fix, right?
Right. And sometimes someone who's been through the problem will very much pretend like they're doing fine.
Right.
Or give misinformation. And we have to know that and say that's because of their history.
Right.
They're not bad or malicious or anything.
Yeah.
But we just have to understand it.
Yeah. So
Speaking my language.
I'm getting the eyes over here from Benita.
Add to that.
That was good. I don't have anything to add right now. Just soaking it all in.
Soaking it in.
Yeah.
So, so just speaking a little bit more about one of the things that has come up, and I actually had a pretty rich discussion with a provider of housing for domestic violence and human trafficking survivors recently, and they were of the mind that that the characterizing some of the behaviors that we see as addictions is not appropriate, and that we should rethink the way that we characterize them. And that discussion, that was a little bit, or that thought really was challenging for me, because I see the behaviors as very sort of synonymous with addiction. Not that you're addicted to being exploited per se, but you're addicted in a variety of different ways to things that come along with exploitation. And let me give you some examples. I know some studies have been done that about the neurons that get fired off in your brain when you're using your cell phone, when your phone rings and you're playing with certain applications. And I can't prove it scientifically, but when you think about the ways that people are so attached to their cell phone, in particular youth, and then you add on that there's this coercive, exploitative person on the other side of that phone that is constantly telling you, I love you, and send me another picture of you that's, doing this or that, and I like that, and I love that, and, and really promoting you to use your phone in that way. I believe that it adds something extra on to this interaction with your phone. I think there's an addiction to the phone, and then there's this thing that happens with a person and the phone that makes it even more powerful, like a love addiction combined with an electronic addiction. I can only tell you, I'm not a clinician, I can just tell you I've observed it. And for urban youth and urban young adults that live in a culture of this, it's so hard to get out of it on your own. And so this is one of the reasons why at the I Am House, we don't allow people to have their cell phones. There's also a safety factor, which I'll get into later, but the main reason is because we want them to reprogram their mind about, I'm using this phone to communicate with people that are healthy and good for me, and I can set boundaries with this phone. I can, and so Tell me what you think about that from a clinical standpoint.
That makes a lot of sense. We're learning more and more about the brain, but we're talking about millions of synapses where thoughts and feelings go through the brain. But I think it's very possible there can be an addiction related to the use of the phone. And think about, for someone who's been deprived, being able to have some say over their life and their communication through the phone. It can be even more important than just the regular teenager.
Right. And so on that point, I think the other organization would argue that that's the reason why they should be able to keep their phone in a house that is built for restoration, because they get to control their own communication, and that's something that they should be empowered to be able to control that communication. Now, there's a safety issue, but I just wanted to get your perspective from a clinical standpoint. Is sort of like empowerment versus temporary timeout while we reframe this. And you don't want people to feel disempowered by not having access to their things. And yet they're demonstrating these behaviors using this phone that are, they seem to be counterproductive. They seem to be unhealthy.
Interfering with the other kinds of interaction that could happen.
Right.
The phone is interfering.
Yeah.
Definitely. Yeah.
Yeah.
And so the challenge of making connections, developing relationships gets affected negatively.
Yeah.
By that focus on the phone.
Yeah.
Really. And they need that because they come without having had that experience.
Right. They may have developed a network of quote unquote friends by way of social networking that are not true friends, that don't treat them the way that they deserve to be treated, but this is all they know.
I know. What comes to my mind is how they can become very dependent on the pimp because of their deprivation.
Right.
And that's something that we have to learn and understand, and so frightened to alter that.
Right.
So moving out is such a huge decision.
It's a big deal. Yeah.
Big, not just decision, big deal.
Yeah, right. Yeah. So, okay, I'd like to talk some more about this because there's definitely a safety component, which I don't really want to focus on too much here, but I want to talk some more about the relationship between a survivor and money, and a survivor and other things that come up cognitively and emotionally, and this issue of attachment and addiction. And I'm just trying to understand it. So we'll be right back with another session of Abolition Radio.
We'll be back with more Abolition Radio right after these messages from our sponsors.
Hi, this is Vanessa Scott with Abolition Radio, where every week we invite you to join the fight to bring an end to human trafficking. Abolition Radio is the broadcast outreach of Love Never Fails, our nonprofit, which is dedicated to the rehabilitation, education, and protection of youth involved or at risk of becoming involved in domestic sex trafficking. Our goal with Abolition Radio is to eradicate human trafficking in all forms, sex trafficking and labor trafficking locally and globally. We are excited to bring this program to KFAX as we will share stories of hope and opportunities to mobilize the body of Christ and turn this audience into an army of gospel activists who will speak up for justice and act on behalf of those who are trapped or recovering from slavery. Find us on Facebook at Abolition Radio or on the web at abolitionradio.org, and join me each Saturday at 3 p.m. for an exciting episode of Abolition Radio right here on AM 1100 KFAX.
Welcome back to Abolition Radio, where you are invited to join the fight against human trafficking.
And welcome back to Abolition Radio, the broadcast outreach of Love Never Fails. So we were just talking about sort of this cross-section of attachment and addiction and having been involved in human trafficking. And one of the things that also I've observed is this mindset or this belief system that is developed around money. And it's like the relationship with money is not to provide for the things that you need. It's almost who you are. You become $80 an hour. You become 15 minutes for $20. And so one of the things that we do in the I Am House is we hold the money in an account for each of our program members. And they're free to access it and know how much it is. And we all sign the same form saying this is how much your money's here. But we do that on purpose so that we can reframe their minds around this money, because a lot of the time, and it's not just in the I Am House, but just in general, I've seen there's a lot of talking about getting the new Jordans, getting the new, the new phone, the new cell phone, getting the best weave, getting the just whatever, getting things, the nails done. Yeah. And it's to productize you. So these are purchases that are made so that you're a better product. They're not what you really want. And until we figure out, until you find your voice and you know what you really want, which we believe is kind of in the 60 to 90 day time frame, until you kind of start hearing like, I really don't want Jordans. All I really want is those $10 jellies that are over there. Those are cool. I really, I'd like to get my hair done. But do I need a $300, pack of human hair to be able to tell everybody I got human hair, or, I got diamonds on my teeth or whatever. I mean, does that really matter to me? And, I think this is not just an issue of human trafficking. It's kind of, it's something that happens in impoverished communities and, in urban impoverished communities where, you're only as good as your tennis shoes. You're only as good as, that's your whole worth, that you got those new J's. And I don't know how to reframe that other than to detach from it for a time, I think about I'm trying to think of something that our listeners might be able to relate to, because our listeners probably are saying, who does that? Whatever. A lot of them might be thinking that. And so think about a diet, or think about, something that maybe you're addicted to eating chocolate ice cream. And for me, when I'm addicted to eating something, I got to be away from it. It's called a red light food for me. It's, in Weight Watchers, they call it red, that's a red light food. You can't eat that. You can't just have one scoop. And so when you know that this is the way your brain has been wired to think that these things are who you are, in my mind, again, this is treating it almost like it's an addiction, is we take some time away from it so we can reframe the way we engage with it. What do you think about that?
I think it's very important that they understand that from the deprivation of childhood and the lack of self-worth and self-esteem, they glom on to these kinds of focus on money and habits. And I think we need to make sure we look at the root of it and help them understand the root.
Yeah.
So that maybe they can be away from it, but then we've got all these other things that I think Love Never Fails us doing to develop that self-worth, that internal self-worth. Because it's just to cover over what's missing.
Right.
And the more there's missing, the more strong wanting to go for the money and the appearance and the superficial things.
I think you've helped me kind of, there's like this place in the middle with that discussion I was telling you about, where it was talking about how we mostly want to build them up, empower them, deposit in them what is missing, rather than take away. This was the organization I was talking to. That was they're more of a harm reduction ideology, where it's let's not take away their phone or not take away their these things that provide them liberty, and at the same time deposit love and reframe a lot of their mindsets, and then the belief system that because you are empowering them and pouring into them, they will eventually use the phone and develop the relationships that are healthier. So that's kind of where they're at. And I'll just tell you that I think the piece that was missing in that conversation is that the safety piece, because I've talked to many young ladies since that time to say, what do you think would happen if we allowed phones in our home? And they said, oh, it would be within about 4 hours you would have an exploiter at your house, because of that attachment deprivation that they have. The pouring in has not yet set in. That has not yet addressed
and that came out from one of the residents?
Oh, from a bunch of young ladies that we work with and young men we work with.
Wonderful.
Yeah, they said, oh yeah, you can't let them have phones, because they will, unfortunately, like, the technique is the right one to pour in and to empower, but you kind of have to take away the phone for a time.
You have to keep reemphasizing, because it'll take them a long time emotionally to understand it.
Yes. And so you have to do that for the safety of all, and for their own safety, because when you're in a confidential location, you kind of have to. Yeah.
And it did come from some of the residents, right?
Yes. Yeah.
That's great.
Yeah. But this is always we always want to learn. So ways that we can do the best way to do things, and we don't want to keep things from our program members for too long. So. We want them to be able to make good decisions for themselves. And so I like that there was that healthy discussion. But in terms of the attachment trauma that and the abandonment issues that many are dealing with, we talked about being by their side as a way to address it, being someone they can trust. How do you do that? How do you demonstrate that you're somebody that they can trust? What do you think are the best ways to do that as a clinician?
Well, just looking at Love Never Fails, any of them who've had any contact with you, particularly Vanessa, feel loved and never judged.
Oh.
And that's what we want to offer them. I think we have to continually educate about what's going on. Now, sometimes they want to go and deal with the loss. And sometimes it's too much for them to deal with it. Mm-hmm. So you have to decide which way you go with that based on, and give them options. Yeah. But if they deal with a loss, then they really probably can make faster progress. But sometimes it's too painful to do. So those are the comments that seem relevant to me. But Love Never Fails is always positive and loving. And that's what they need. And I don't think they get that other places.
Yay.
It's really true.
Yeah.
I say to them, Vanessa said that? And they said, yes. I said, I understand that.
Yeah. Well, and it's so genuine. They're so
absolutely.
They're so easy to love for me. I mean, I just see so many wonderful things about them. And, as with all of us, I mean, there's, if you look hard enough, and in many instances, you don't have to look hard at all. There's just so many wonderful things to say about everybody you meet. So, So thank you. That's awesome. Well, anyway, if we're going to come back, I want to talk a little bit about what we're doing with the University of Phoenix. That's exciting new development. So we'll be right back in just a moment with another session of Abolition Radio.
We'll be back with more Abolition Radio right after these messages.
This is Pastor Gary from Faith Fellowship in San Leandro. We are so excited about the launch of Abolition Radio every Saturday. And we have seen Love Never Fails under Vanessa Scott grow right here in San Leandro out of our church at Faith Fellowship. And now her ministry, God gave her a passion to get young people out of the sex trafficking and sex slave industry. And she has been doing a phenomenal job. Not only is it locally, but now it's going globally. In fact, I prophesied to her that God was going to use her to go nationwide, and that's exactly what's been happening. She is a woman with a vision, with a direction, and a passion to see these young people come out of this kind of arena. And to God be the glory. Join with her every Saturday on Abolition Radio to hear what she has to say and then become a part of what she's doing. AbolitionRadio.org. Love never fails.
Welcome back to Abolition Radio, where you are invited to join the fight against human trafficking.
And welcome back to Abolition Radio, the broadcast outreach of Love Never Fails. So, exciting new development. Actually, Dr. Crofts, who's been providing emotional and cognitive therapy in the IM House on a voluntary basis, thank you so much, is now going to be supervising a couple of interns from the University of Phoenix in the master's program there. So we are so excited.
Yes.
Yeah. So we are going to have 3 interns potentially assigned to us. We're still kind of working through the details, but they will be working in both phases of our home and then also one for mobile work. And super excited about that. And you know what I love about it most of all is that the creativity in providing services at low to no cost. It's like quality care at low to no cost. I mean, the best. Who thinks of this stuff? God, you are so good.
Yes. He has it all planned out.
We'll be sitting around and going, how are we going to do this? We need this. And all of a sudden, boop, Dr. Crofts shows up. And then 6 months later, boop, someone called from University of Phoenix. Like, okay, I'm just sitting here. I'm going along for the ride. Anything you want to add on to that? Yeah.
I just remember when I said I was interested in service, you said, we need a clinical psychologist. It was as if it was perfect timing.
It was. Yeah. We were just opening the house. It was amazing.
Always.
Yeah.
So, yeah. So just kind of diving into the second phase of the home. So as you know, part of our goal is to continue to provide cognitive and emotional clinical care to folks that are in the home and get them work ready and, re-engaging in the school, education environment and so on. And, that's during stabilization phase 1, there's, it's sheltered, right? It's very, there's a structure around it. You know what's coming from 9 to 10 to 11 and, a few bumps here and there, but for the most part, you know what's going to come. You start getting out and going to school and work, and there's all this stimuli that's out there and all these people that are trying to ensnare you. And so, I see that there's a huge need for continued care, right, in phase 2. And any thoughts about that? I know the intern will be working under your supervision with the people in the home, but in terms of techniques that one might be able to use, I know seeking safety is the basis of our program, but any thoughts about how, when somebody is re-engaging after being, coming out of sort of a place of stabilization where everything is sort of benign, what are some of the techniques that you plan to discuss with the students that you'll lead? I
certainly see working in group therapy as really, really helpful in terms of talking about these concepts that we're talking about and developing this trust where they begin to share what their feelings are, and hopefully the trust where they can share their history, and then ongoing contacts and how they are impacting them emotionally, so that we keep that focus there with the interns. It's supportive, but also so important to be able to see and learn from.
That's you have a wealth of experience, of those stories, those various conditions from those within the home, for sure. And just that gentle concept that I'm talking about of how your past has affected you and how you're growing and developing and how strong you're getting, focusing on those things seem really important to me. Yeah, strength-based, right, care. Yay! Yes. She's not yet an art therapist. She's pursuing her art therapist license, Serena. And she always focuses on that. I remember meeting her when she was working somewhere else, and she was just really helped me to see that actually it's the way that I'm wired to be more focused on people's strengths, but it's something that is so important. I think
empowering people and seeing the good in what, even when they, like, I remember, and this is definitely part of seeking safety. I remember when one of my family members was lying, basically, and I said, you know what? If you tell me that you lied before I catch you in a lie, that's a better scenario. Mm-hmm. And so I gave him a time frame to, like, let's say you catch yourself saying a lie, and then 5-10 minutes later you're like, you know what? I just lied. Then we'll just laugh about it. Like, okay. Yeah, I could see where your knee-jerk reaction would be like, no, I did, and even if it's like lying about nothing, because sometimes you might just lie that you just drank out of a purple cup and it was really yellow, just because you're so used to doing that.
Exactly.
Yeah.
So then if you just say, but we want to get used to doing something different, so let's open up a different way of behaving. So just tell me that actually it was yellow. Even if it seems insignificant, just tell me it was yellow, and we'll laugh about it, But what do you think about that? In particular with the lie, it seemed like it was resonating with you, the whole lying thing, and how to kind of rewiring the way the brain works a little bit,
and giving that idea that you're not horrible if you lie. Just do your best to recognize it and express it
and correct it.
Yeah,
exactly.
Yeah.
Yes.
Yeah. So,
and I think also are really looking for strengths they begin to gather that are more important than paying $300 for the hair.
Right. Yeah.
Is really important. Love, connection,
right,
caring.
Yeah.
Responsibility.
I've noticed that another pattern that I've noticed is that there's a heavy reliance that the family places on a lot of our program members. I'm mostly thinking of people outside of the house that you may not have worked with, but just a lot of reliance on the family members to do childcare, to clean the house, to just to kind of, and so there's this devaluing where you don't even know what you're good at and what you like to do and what you're worth. And so I kind of feel like the mom in me is looking for that thing that what are you good at? Are you do you like to sing? Oh, why don't you sing for me? You like to dance. What do you do that really gets you going? And then that oftentimes will drive a person towards a new minds away from that. Because if you had that $300 and you could book some time in the studio to make an album versus getting that pack of hair, would you just flip your hair back in a ponytail? You sure would. You sure would.
You bet.
Because you were going to do what you were passionate. Okay.
Right.
So.
And even use that passion to make even more money than the $300.
Right. Entrepreneurial.
Yeah. Once that switch comes on, and gets flipped. Wow, man, if I get the hair right now, I can go and do this and make myself better.
Right. And get a big old pack of hair later. Right?
Self-empowerment.
That's right. Yeah. And, it's so funny we're talking about hair because in our country where, there's been so much racism really about the way a black woman's hair is. And then a lot of sort of systematic emphasis that, your hair needs to be a certain way. It's really refreshing at this day and age where we can go around and just wear natural and again, and not, and not have it be, you're not taking care of yourself or you're not pulled together, So it's a great time to not have
it be, but it's okay. If that bothers you, you do you.
Right.
And let me do me.
Yeah.
That
diversity is there, and an openness to it. It's okay.
Yeah.
Yeah. All right. We're getting free in here.
That was a diversion, but that was a good one.
Well, yeah. I think, it actually has a lot to do with the self-worth and the identity of our ladies.
And the empowerment.
Yeah.
Oh, the empowerment.
Yeah. So, okay. We'll be right back with another session of Abolition Radio.
We'll be back with more Abolition Radio right after these messages from our sponsors.
Trash bills weighing you down? At Case Industries, we specialize in lowering waste costs and providing trash consolidation and compaction services for multifamily properties, condos, and commercial shopping centers. Let us help you reduce operating expenses and increase property NOI. Case Industries, saving the planet, saving you money. Contact us today for a property trash and recycling assessment online at caseindustries.us or call 510-566-4223. That's caseindustries.us or call 510-566-4223. Case Industries, the property manager's friend.
Hi, I'm Sandra Herrera, CEO of Case Industries. I've found that many employers are looking for ways to help the community but don't know how. I encourage you to consider supporting Abolition Radio as a corporate sponsor. Love Never Fails offers all the resources necessary to help young women and men overcome the trauma of exploitation and abuse. And that's why I'm proud to have Case Industries supporting Abolition Radio.
Welcome back to Abolition Radio, where you are invited to join the fight against human trafficking.
And welcome back to Abolition Radio, the broadcast outreach of Love Never Fails. So we want to thank you for continuing to support this radio show and our organization. We want to just call out to you that we are here in August, and we are always in need of sponsors and of support to keep this radio show on the air. And so if you would like to have your business operate as a sponsor for Abolition Radio during the commercial breaks, I'm sure you're hearing words from some of our other partners, and Case Industries and Faith Fellowship and others. And we want to make sure that you know that you can actually participate in that for a very reasonable rate. And so please do reach out to me for more information on that. It's Vanessa@loveneverfailsus.com, and we can discuss that further. But again, great opportunity to promote your business. Also, like our page, which is Abolition Radio on Facebook, or listen to past episodes on abolitionradio.org. We also invite you to like our Facebook page for Love Never Fails, which is Love Never Fails, and our Twitter feed, which is at Love Never Fails 5. So do get in touch with us via social networking. Stay plugged in there.
Yes.
We also want to invite you to buy a ticket for our not New Year's Eve, but it's going to be just after the New Year in 2016, our Imagine Me Gala. And that will be on January the 16th. That's a Saturday from 6 until 9 or so p.m. And so please do go to our website, loveneverfailsus.com, and you can go ahead and pick up a ticket. The tickets are $100 each. And we also have some sponsorship opportunities: bronze, silver, gold, and platinum. This is the main way that we will be raising funds for the I Am House. So we want to invite you to become partners with us in the I Am House and in providing services to those who need it so much. And Benita, we have some other events going on in the community.
Yes, tonight at Templo de la Cruz at 4 o'clock, or I guess it's really early evening, we will be having our Love Never Fails tour. And we invite you to come on out and purchase your ticket, which is your T-shirt, at the door this evening. And that is, once again, at Templo de la Cruz in Hayward at 4 o'clock. Also, our afternoon outreach next Saturday at Lift Ministries, 22580 Grand Street, Hayward, from 11 to 1. Mm-hmm. If you have need of any food or clothing, come on out and help be served there in that way. And we will, we have a big event coming up on that day in our ministry, and my partner in justice and Pastor Tim Russell are joining as man and wife on that day. So we will be postponing our usual evening outreach for the month of August, but stay tuned for the Septembers. But please join us for our Mentors for Positive Change training. If interested in that, it started today, and you can contact mentors at loveneverfailsus.com, and they can get you all caught up if you're interested in becoming a mentor with us. We're doing a crash course on Saturdays for the next few Saturdays. So contact mentors at loveneverfailsus.com for more information there.
Yay. And if you'd like to volunteer in the I Am House, the Mentors for Positive Change program is a prerequisite for doing that. So please do get engaged with mentors at loveneverfailsus.com.
Yes.
And then also there's some additional training. We do require 40 hours of training to become a human trafficking protected worker and work in our housing program or in any direct services capacity. So please do reach out to mentors at loveneverfailsus.com. Also, a couple other things. So I think Benita mentioned it, but for the outreach, again, we're canceling August.
Yes.
But we are going to be going out on September 19th.
Okay.
From 6:30, we'll meet at Faith Fellowship Church, 577 Manor Boulevard in San Leandro, and then we'll make our way out. We haven't declared where we're going to go yet, but we will get back to you with more on that.
And don't forget on the 12th of September at Faith Fellowship.
Oh, yes.
The beauty conference for girls.
The Beauty of a Woman conference.
Yes.
All right. Well, awesome. So lots of ways you can get involved. Again, please do support us. We covet your prayers. We need you to be on your knees daily. Please put us on your list. Put us on your church list. Whatever, in whatever way you can. Please be sure to remember us. And again, we always want to end our show with a very important message. But before we do that, I want to thank Dr. Crofts. Thank you so much for being here with us.
Yes.
And for just pouring into our house. And we're going places. We're going places.
And we're excited about the work you're doing with the women.
Yeah.
Thank you for having me.
The new program coming up. Yes.
Thank you. So again, we want to end our show with a very important message. We want you to know that you are loved.
Thanks for joining us this week on Abolition Radio. We trust that you've been inspired by these stories of hope and survival, and that you'll accept our challenge to get involved by contacting us at abolitionradio.org, by liking and sharing our page on Facebook, Facebook/Abolition Radio, or by making a contribution directly to Love Never Fails. Abolition Radio is the broadcast outreach of Love Never Fails, which is a donor-supported, nonprofit ministry that Vanessa founded as a way of directly impacting the lives of young people who are trapped in or at risk of becoming involved in sex trafficking. This broadcast needs your involvement and support. To find out more, simply go to abolitionradio.org and click on Love Never Fails. Today's program was brought to you in part by Case Industries and with major support from the staff and membership and donors at Faith Fellowship Church. Our theme song, Courage to Believe, is by Justin McRoberts. Hear more about his passion for justice and art at justinmcroberts.com. Our audio engineer is Jarrell Martin, and this is Dave Naderhood. On behalf of Vanessa, Benita, and the whole team at Love Never Fails, thanks for listening, and thanks even more for taking action to help set captives free.
You're in the neighborhoods we live in. You're in the ones we're passing by. You're in the ones we call our neighbors, and the ones who still sleep our eyes.